Ah, so it can cure cardiac troubles, osteoarthritis, and so many other illnesses.
It's especially good for degenerative illnesses concerning elders. If an elderly person has contracted tuberculosis, that won't help, and it won't help in the case of cancer. But all types of degenerative ailments, such as arrhythmia, hepatitis, cirrhosis, Parkinson's disease, and multiple sclerosis.
It improves it, it doesn't cure it.
It is an additional treatment.
An additional treatment.
Yes, absolutely.
You can't do miracles.
We don't, but we give them some autonomy, especially in cases of hemiplegia.
And what about osteoarthritis? Does it ease it or stop it?
It stops it, because the mechanism is such that it gets rid of the tendinitis caused by the calcium which packs the articulation. They start spinning at a vertiginous speed under the effect of the waves, and then fall, very much in the same way as fruit on the tree falls after being turned and then just comes down to the ground, you know?
You might have noticed that we have an armchair on the stage and things here and there. As we have seen in the documentary, it is a magnetic belt. If you don't mind, Doctor, could you please go to the chair and show us, please, how it works? Would you show the audience too, please?
Yes,
Thank you.
I can, absolutely. As you can see, this is a magnetic chair with magnetic electrodes. There are around 20 of them. Now, if I bring this marble closer to the electromagnet, you will see the ball starts moving, being attracted to the magnet, and it looks just like it's dancing. Now, if I put my hand on the electromagnet and the marble on top, rather, it's still dancing, which just shows that waves can pass through the whole body. Now, if I use another method, such as this lamp, you see, it's on.
Oh, you're not touching the electromagnets,
No, I'm not touching the electrodes. Listen, even if I put my hand on it, it also gets magnetized. See it? The light is still on here.
I see. Well, please come back and join me here again. How long do sessions last? How many times a week?
The sessions last 30 minutes. And if you possess such an armchair, you can even do it morning and evening. But 3 or 2 sessions a week are sufficient. This is, though, an additional treatment, not the only one. It generates electro- or magnetoporation, which means the pore of the cells open and thus let the drug pass through. Consequently, we need a lesser amount of the drug.
And if you interrupt the treatment, will your patient get back to the previous stage of osteoarthritis?
No, because at the beginning, we compel the articulation, the cartilage, to produce the substance needed for the cartilage. What we'll do is we'll get rid of all the calcium and all the enzymes, the protease, which tend to destroy elastic fiber, are then stopped and inhibited, especially the elastic fibers and the collagen.
But will the process reappear little by little?
The process might start again after 6 or 7 months, but one can always undergo another treatment.